Good afternoon, everybody. I'm Tatjana Rakar. I'm an associate professor at the University of Ljubljana, Slovenia, at the Faculty of Social Sciences, at the Department of Sociology. In my research, I mainly focus on social policy, family policy, work-life balance, and also care issues, and also in relation to the third sector role within the welfare system. So I'm very happy to be here. It's my pleasure to provide an overview of parenting leave policies in Slovenia and inequalities associated with them. So in terms of parenting leaves in Slovenia, before I start with introducing them, I would like to mention that we had a very well-developed family policy already in the socialist period in Slovenia, particularly in the area of parenting leaves as well as childcare facilities. And after following the Slovenia independence in 1991, this comprehensive family policy was further expanded as well as also preserved. We also had a special office for women policy established at the Ministry of Social Affairs. And during this period, existing measures were extended and further developed. So to start, similar as in other countries, we have three types of parenting leave. So we have maternity leave, paternity leave, and parental leave. In terms of maternity leave, the purpose of this leave, as defined in our legislation, is the protection of the mother's health and care for the newborn before and immediately after the birth. And length of this leave, it's 105 days, and 28 days are taken before the birth, and it's obligatory for the mother to take 15 calendar days of leave. Payment, it's 100% of average monthly earnings during the 12 months prior to the leave. And also, if the contributions were paid during a period shorter than 12 months, there is an amount currently 685 euros a month that is counted in for this missing period. And there is no upper limit for the maternity leave, and the minimum is 685 euro. In terms of eligibility, the person must be insured under the parental protection insurance and only at least 1 day before the leave starts. But also in cases if the mothers are not currently insured, they are still eligible for earnings compensation if they were insured at least 12 months in the period of last 3 years. The maternity leave, it's not citizenship-based and depends on insurance status and also residence as well, permanent and as well temporary residence for flat rate benefits. So both the mother and the child need to reside in Slovenia. In terms of flexibility, this is a continuous leave, but the part unused before the birth, in case if the birth took place before, can be used after. And of course, there is a very limited transfer of this leave, only in very exceptional cases. In terms of paternity leave, the purpose defined in legislation is to enable fathers to participate in early childcare and bonding. Currently, this leave it's 15 calendar days. And the payment, it's the same as for the maternity leave, but with the difference that there is an upper limit of 2.5 times gross salary in Slovenia. In terms of eligibility or citizenship, residence condition is the same as for the maternity leave. And in terms of the flexibility of use, paternity leave may be taken as a full-time or part-time, but as a continuous leave until the child's age of 3 months. And what is important also, the duration of leave does not change if it's taken part-time. And finally, in terms of parental leave, this is defined as a leave that enables both parents to care for the child after maternity and paternity leave, and also to reconcile work and family life. Currently, the length of leave is 160 calendar days per parent, and this is an individual entitlement, and from which 100 days are transferable to the other parent. The payment is the same as for paternity leave, and also here it's the upper limit of 2 times gross salary in Slovenia. In terms of eligibility and citizenship residence condition, it's the same as for maternity and paternity leave. But in terms of flexibility, each parent can transfer up to 100 days to the other. And what is important that this leave can be taken full-time or part-time, but also if taken part-time, this does not extend the duration of leave. And understandably, one parent must take the leave after maternity leave. And what is important that each parent has also 60 days of non-transferable leave until the child is 8 years old. And for example, for the fathers, these non-transferable 60 days of leave can also be used during the maternity leave. And what is also important that both parents can take part-time leave at the same time, so 20 hours per week each. And shortly, in terms of historical development, as you see, we had a very early introduction of maternity leave, also in 1927. For example, in 1958, these were already 105 days of maternity leave. And then in 1975, there was an introduction of parental leave, which at that time was called childcare leave, and was 141 days, and was also transferable to the father. But in this period, actually, nobody from the fathers took this leave. In 1986, the parental leave was already extended to 260 days, which meant that together with the maternity leave, we already had 1 year of parenting leave in Slovenia. After the Slovenia independence, we got the unified system of leave that was also set in the legislation of total of 365 days of leave, maternity and parenting leave, or childcare leave that was called at that time. This leave was already flexible in use, so it could be used part-time until the child was 17 months old, and there was also a special extension for twins. In 2001, we got a new Parental Protection and Family Benefit Act, which introduced 260 days paid parental leave, which was meant to be shared between parents. But what is important that this was a family right, not an individual right of each parent like we have now, for example. So in 2003, we already got a paternity leave, which was introduced gradually. Firstly, these were 90 days in total, and 15 days were fully paid, and 75 days were unpaid. But of course, nobody took these unpaid days. In 2014, we got a complete new legislation called Parental Protection and Family Benefit Act, which is still in force today with several amendments. And this act was also aligned with the Parental Leave Directive from 2010, especially in the shift toward individual rights for each parent, not anymore as a family right. And paternity leave in this period until 2008 slowly, gradually was extended to 30 fully paid days. And the last reform was in 2023, in line with the EU Work-Life Balance Directive, which introduced 160 days per parent, so 320 days in total. And what is important, 60 days per parent non-transferable were introduced. This was actually a compromise because the public opinion at that time was not in favor of reducing the right of the mothers in terms of parenting leave. So they introduced this extra 60 days. So what does it mean in practice? Actually, the father may still transfer 100 days to the mother, and as the data show, they usually do. So the mother can still use 260 days, but the father now has 60 non-transferable days on his own that can be used up to the child's age of 8 years old. And in line with this shift toward parental leave, paternity leave was reduced from 30 to 15 days. There were no further changes except in the last year, in 2025, there was a small expansion, but only in terms of the rights extended to foster carers for older children up to 8 years old. So who is eligible and who is not? As we saw, the eligibility for parental leave in Slovenia depends on parents' contribution to parental protection insurance. And what is important that this insurance covers persons on different employment contracts, both permanent and fixed-term contracts, either full-time or part-time, and especially important also the self-employed, including the farmers. In terms of rights, the parental leave and earnings compensation are the rights of biological, adoptive, and foster parents. And in regard to same-sex partners, from 2022, after legalization of same-sex marriage and joint adoption, they are also eligible for the parental leave, but only if they adopted the child. If the child was not adopted by them, the biological parent is entitled to the whole leave. In terms of migrants, they're eligible for parental leave under the same rights included in the parental protection insurance, and in terms of flat rate benefits, also if, of course, legally residing in Slovenia. It is important to mention also that for those without contributions, so not eligible for the insurance-based leave, which are students, unemployed, and also migrants, we have a parental allowance. The only condition is that the parents and the child must live in Slovenia. This is a flat rate benefit, currently €507 per month for 365 days. And within this, the mother receives benefit for the first 77 days. And after, based on the agreement, the parents can share this leave. Again, I would like to mention in case of the unemployed, but for those who are not currently, of course, insured, but were insured at least 12 months in the past 3 years, they receive an amount of 685 gross euro per month, plus some extra funds for each month of past insurance, but not more than 340 euro gross. Going to take-up rates. In terms of maternity leave, this is a mandatory leave, so nearly all employed women take it, usually full leave. In terms of paternity leave, the take-up rate is around 90%. This was also in 2025, and same in the previous years, although in the past this percentage was slightly higher. In terms of taken days, the average, it's a bit more than 10 days, and this paternity leave is typically used when the mother and the child return from the hospital. In terms of parental leave, still most mothers take the full entitlement, and the father's share remains low, around 4%, and in the last 10 years, this didn't really change. And then the introduction of 60 days of non-transferable leave for fathers, we could perhaps say that it shows impact. As, for example, in the last year, there was an 86% uptake of this 60 non-transferable day, which is really much higher than the transferable leave uptake. So this could suggest growing father involvement and perhaps shifting attitudes, but we should be very careful about this take up, as we don't have sufficient research, as probably there is also a gap that it is taken by fathers on paper, but not really in practice by taking the leave to care for the child, especially in case of the self-employed. So further research is needed about this, the shifting attitudes. To conclude, in terms of gender equality, as we saw in Slovenia, the core inequality persists in gender take-up. So formally, both parents have equal entitlements, especially after the last reform, but in practice, the leave remains strongly feminized. So why? For sure, due to persistence of traditional gender roles, mothers take most of the leave, which is also shown in public attitudes. And also importantly, the wage differences make it economically more rational for the mothers to take the leave. Also, perhaps lack of supportive workplace culture. Despite many government campaigns, as was a very nice one recently, for example, Active Fathers Make the World a Better Place. So it is still very much gendered, the take-up. To conclude, in the literature, Slovenia is socially usually labeled as a country with a more inclusive access to parental leaves, labeled under universal adult worker model or universal mixed model. Which means wide eligibility coverage, as we saw, inclusion of different labor market groups, and most parents can access to some form of benefit. We have on the other side this dual structure of benefits, earning-related benefits for those with contributions and flat rate benefits for those without sufficient employment history. We have a very generous compensation levels, but only for those with contributions. For the flat rate benefits, they're substantially lower, also be much lower the minimum wage and living costs in Slovenia. So we can see that Slovenia scores highs on coverage, but lower on equality of outcomes. So we have this dual system of insiders versus outsiders. So, for example, on one side, parents in standard employment with full access, high benefits, and then on the other side, the precarious unemployed with lower benefits. And of course, the increasing precarious work will deepen these gaps. Finally, a word about the research gap and data gap in Slovenia, as also shown in a report by this cost network. We have an administrative data gap, and the data do not allow calculation of mothers, fathers' use of paid leaves in terms of overall uptake, annual trends, eligibility-based rates. So I usually combine this with birth rates together with the take-up rates. And I would also like to mention that particularly under-researched area in Slovenia, it's the link of policy design with workplace practices. So it's really a missing research, especially on the employer's perspective on leave take-up. So this is shortly from me. Thank you very much for your attention and open for discussion. Thank you.